Alright, so I did my respiratory project over lung cancer. Lung cancer is by far the leading cause of death among men and women. About 1 out of 4 cancer deaths are from lung cancer. The lungs are a pair of spongy air-filled sacs. There are 3 lobes in the right lung and 2 lobes in the left lung. Alveoli are the only true respiratory zone structures. They are responsible for gas exchange, which occurs by diffusion across the walls. Lungs are also covered by pleura, which acts as a lubricant, allowing the lungs to expand so we can inhale and exhale. In this next slide, I've compared a healthy lung to your left versus a cancerous lung to your right. As you can see, the left lung is pink, very healthy looking and thriving, while the right lung is blackened and almost looks dead. There are 3 common types of lung cancer. The first is adenocarcinoma, which starts off in the peripheral lung area. This type of lung cancer occurs mainly in current or former smokers, but it is also seen in non-smokers. They appear as slow-growing nodules that develop from bronchial glands and alveolar cells. Next is the squamous cell carcinoma, which, like its name says, starts in the squamous cells, which are flat cells that line the inside of the airways of the lungs, causing masses that will eventually cavitate and bleed out if not taken care of soon enough. Lastly is the famous small cell carcinoma. Small cell carcinoma originates in the bronchi and round cells. They form in the mediastinum and grape-like structures that are very aggressive and take over rapidly. I have attached a picture of an X-ray image of the lungs showing a small cell carcinoma mass in the right lung. Next, we have the causes of lung cancer. However, we truly don't know exactly what causes it. We do know of some factors that can impact it. The main and most popular one is smoking because, as we all know, the nicotine can damage our lungs. Secondhand smoke can also affect you. Even though you're not smoking directly, you are breathing in the same thing that the smoker is. Next is going to be exposure to radon, um, as well as air pollution around you, also including workplace exposure to different chemicals that can also be damaging to the lungs. And lastly, we have inherited genes that can affect us as well and play a role in lung cancer. Some cases have shown that lung cancer can be passed down throughout the family depending on your genetics. There are also signs and symptoms associated with lung cancer. The first and most common one is a persistent raspy cough, which can lead to the coughing up of blood. Coughing so hard and so often can then lead to a shortness of breath as well as chest pain. Sometimes people with lung cancer can get pneumonia or bronchitis very often. And lastly, you can also experience swelling of the face or neck area that can be associated with lung cancer as well. Like all other types of cancer, you have multiple treatment options. The most popular one is going to be chemotherapy, which is an anti-cancer drug that can be taken orally or be given intravenously. It then enters the bloodstream and begins its work by traveling throughout the body. And note that chemo impacts cancer cells, but it can also impact healthy cells as well. You can also combine chemo with radiation. There are 2 different types of radiation, including internal, which includes a tube that is inserted inside of you that is connected to a brachytherapy machine to get right there on that mass to be able to shrink it. While you have external radiation, which is beams outside targeting down on the mass while you are laying on a table. Lastly, you have the option of surgery if the doctor feels it is necessary. There are three different types. The first is a pneumonectomy, which is strictly removing the entire lung. Then you have a lobectomy, which involves the removal of the entire lobe that is impacted by the mass. And lastly is a segmentectomy, or also known as a wedge resection, which is when only a part or the wedge of the lung lobe is removed. And this surgery is most common when a patient doesn't have enough lung function to withstand removing the entire lung. I've attached three different images showing the surgeries and different pieces that they take out regarding their name. And lastly is a works cited slide. Thanks for listening.